The slow return to normal. Joining us on Columbus on the Record this week, Jesse Balmert, State House reporter for the Cincinnati Enquirer, Bob Clegg, Republican strategist, and Sam Gresham of Common Cause Ohio. Spring is a season of hope and renewal, and there are signs that life soon will start to get back to normal in Ohio. With cases on the decline and more people getting the COVID vaccine, government officials are starting to loosen the rules. Starting March 1st, indoor arenas and concert halls can have spectators up to 25% of capacity. Outdoor sporting events can have fans up to 30%. Governor DeWine says Ohio is crossing a bridge to normalcy.
And the bridge is really built on two things. One is vaccinations, and the other is to continue during this bridge to continue to wear masks.
Jesse Balmert, cases are much better than they were in the fall, late fall, early winter, but they're still high. But what is driving the governor's thinking right now and trying to loosening the reins a bit on the restrictions?
Well, I think it is largely the numbers. So the number of cases has been down, but perhaps even more importantly, the number of people in hospitals for COVID-19 has been down. The number of people in intensive care units for that has been down. And that really shows you that like the most serious cases are not as prevalent as they were in December. We've seen a pretty marked decrease since the winter, or the middle of the winter, I suppose. Yeah. We're never going to be done with winter in Ohio. So I think that is really what he's looking at in order to ease some of these restrictions. I think there's also just people are tired of being cooped up and all of the restrictions. So I think if you give people an opportunity to do things in a safe way, then there will be less frustration.
Sam Gresham, you could argue one of the reasons, more people are getting the vaccine, which is great. That certainly is helping keep cases down. But you could also argue that, the visitation part of the year was really slow, starting, after Christmas and through February. People aren't getting together for big gatherings. And that might be one reason why the cases are down. Is this perhaps too soon in your mind? Is this the right time to start loosening the reins a bit on the restrictions?
I'm the guy that believes in the most austere preparation and hope for the best. So this doesn't fit into my wheelhouse. I think we should keep it locked down until we get the positivity rates at a level that makes us comfortable. I also feel uncomfortable with the schools, and I have grandchildren going with the schools. It's hard to predict where we're going to be today with the positivity rate and 2 weeks from now. And if you open it up, you run into a negative positivity rate down the way. So I'm not comfortable yet. And I'm not in a hurry to get out with 1,000 people. I'm just not in a hurry.
Yeah, Bob Clegg, I think people are still going to be reluctant individually to go out, but this does allow, concert halls, the symphony, things like that, the Blue Jackets, they did ask for 10%. They got 10% capacity, now 25%. It's a big arena. Should the governor even be moving a little bit faster to allow people who are comfortable, perhaps people who are vaccinated, to go out and attend these events?
Yeah, I think that, I'd like to see it move even faster, but we got to be aware of the medical concerns that are out there. But you make a good point. Individuals that have already been vaccinated, I don't see any reason why they shouldn't be allowed to just go out and wear a mask still, but join in these kinds of events, because the chances of them either getting it or spreading it is much, much lower because they're vaccinated. And I think we're going to have to start adjusting all of these things when the percentage of our vaccination rate keeps going up. And the higher it goes, obviously, the more things should loosen up.
Jesse Balmert, we really don't know, even if you've been vaccinated, if you can carry the disease and give it to somebody else. I think hopefully we'll start to see more and more research into that, and might give us more comfort into saying the vaccine not only prevents you from getting sick, but prevents the spread. The next step is festivals and fairs and things like that. And it's harder to control events like, say, the Columbus Arts Festival, which has been canceled anyway, but because there's no ticket there. So you can't really limit participation. That's going to be tougher for the governor to loosen up on.
It's true, but I think one of the benefit of those activities is they are outside and you're getting a little bit more airflow. I think if they're able to limit the number of people, I think one thing that a lot of people are pushing for is the county fairs to be more than just like the junior fair activities for children, to have like a more robust county fair experience. And the governor has said that, he's willing to work with fairs to get to that point. So I think there's some cause for optimism that that will move forward. But again, it's all about, how much distance is there? Can you wear a mask? Can you wash your hands and sanitize and so forth? I think those practices are going to be with us for a little bit here.
Bob Clegg, on the issue of masks, the governor said that, you're still going to wear a mask. If you go to the Blue Jackets game, if you go to the Clippers game, when their season starts, the baseball season starts in the spring. How is that going to go over? Are people going to be okay with that, wearing masks, really through the summer?
Well, I think there's always going to be people that don't want to, but I'll tell you what, I have no problem with a facility, indoor facility, whether it's a business, whether it's an arena. I don't have any problems with them requiring individuals to wear masks to go into their facility or business. You're going to have people that are going to be upset about that, but it's the times we live in right now. And if you want to participate in those kinds of activities, then you're going to have to abide by that rule, which is wear a mask.
Sam Gresham, these festivals and concerts that the governor was talking about, professional sports events, these are big ticket items. What is the status of vaccination in the Black community in Columbus? Is it progressing better than it did at the start, or is the state and pharmacies and school and institutions getting out into those communities, and are those communities willing to take the vaccine?
Well, let me have full disclosure. I've had Pfizer 1 and Pfizer 2, but I had to go to the white community to get that vaccination. We have sent other people to that same site, and they've been turned away. Now, the site was not in the inner city. It was in Reynoldsburg. But we sent some 20 couples, that's my wife and I, to that site using that link. And out of the site, 18 African Americans got served, 2 got turned away.
Do you know why they were turned away, Sam?
Yes. 2 groups of people, 4 people were turned away. So they had to come out of their community, go to Reynoldsburg to get a vaccination. They couldn't get it in their community. And there was some consternation when they went. When I went, it was interesting. 2 things they did. They didn't want any video, and they didn't want any photographs. They didn't want you taking any photographs or all that. Now, the people treated me well. I had no problem with that. But in all my visits, I saw very, very few African Americans. It's a large room up in Reynoldsburg High School. I don't know what the room for. There must have been 800 to 1,000 people up there.
Jesse Balmer, any new news there? I know Mayor Ginther had a thing this week in the city of Columbus where they brought a vaccination clinic, a mobile clinic out to an inner city neighborhood, a neighborhood where there are a lot of folks, people of color who live there. Any news on the state increasing its efforts to try to get into these neighborhoods that are poorly served?
It's interesting. There's been a recent push from the Ohio Legislative Black Caucus Foundation and a few other groups saying that African Americans should be treated as a priority group, like someone who might have an immunocompromised condition, or a lot of different professions are trying to kind of move up the list right now, or figure out where they are on the list right now. And the reasoning behind that is, disproportionately COVID has impacted communities of color, and also just disproportionately the effects have been higher. So that's a push that's being made, but the governor hasn't been real clear about what groups of people will be next, except for he has said that the next age group that will be included is those 60 years old and above.
Yeah, like they made the exception for teachers, for instance. And usually at this time of the year, students are preparing for spring break with, half an eye on getting out of school. Well, this year, for many Ohio students, they will finally be getting back into the classroom. Columbus City Schools has announced middle and high school students will be back in the classroom 2 days a week. Elementary school students started doing that earlier this month. Other school districts are doing the same. On the college level, OSU has announced it plans to have a lot more people back on campus in labs and in lecture halls this coming fall. Sam Gresham, you mentioned your grandkids in going back to school. Could you elaborate a little bit more on that? What's the feeling among them, their parents, their neighbors, their friends? Are they ready to get back into the classroom?
I had a 2-day conversation with my 10-year-old. She was a little concerned going back to school. And it had more to do with the socialization process. Were the kids going to be there? Are they going to see their friends? Are my teachers going to be there? They've changed significantly. I have qualms about sending these kids back to school. I have qualms about opening up everything. I think elementary school kids are okay. I'm not sure high school kids should be going back in the classroom. I understand the psychology, the sociology, and all that stuff. But I think if a kid gets sick, that's a long-term problem. That's not a cold. That's a long-term problem. Their parents have consternation too. When you have 2 people in a household, parents struggle with this idea, and their concern is they only have this child. And if something happens to this child on their watch, they're really upset because sometimes you can't change it.
But Sam, the science, they've done a lot of studies, and they show that as long as the students and faculty and staff are wearing masks and they keep reasonable distance and sanitize, that the spread in the school, even if the spread is high in the community, the spread in the school is pretty low.
Well, I can agree with that, and particularly with the Columbus schools, because a number of their schools have been renovated. But it's still one. All it takes for me is one of my grandchildren to have this problem, and I'm an unhappy camper. So for me, I want to go to the furthest distance to keep them from even getting in that environment, even with the problem they're having sociologically. I just don't want them to have problems. So I'm the most draconian on this issue. Stay your butt at home until this stuff is over.
Bob Clegg, the push by the governor was to get the teachers vaccinated. They jumped the line. It seems like most of the teachers are going to get their second shot, probably maybe the second week of March. That's when Columbus goes back right after what their spring break would have been. How do you view the situation with getting back to school?
Well, my youngest son is a freshman at Olentangy High School, and he's been going to school every day since last August. I'm not like Sam. I think the kids have to be in school. I think we're losing so much. These kids are losing so much, not just on the socialization, but learning. I know that we're going to do some testing in all the schools here in Ohio. The federal government, President Biden has said he wants to have testing to see how far behind all of these kids have fallen. And I really worry about kids that are like in the city of Columbus school district, where school is, for a lot of them, a stable anchor that they go to every day, where they get their meals, and it's a lot of their life. And I think we got to do everything possible to get all kids back to school.
Jesse Baumert, the governor had some, fairly strong words in the past few weeks for school districts that weren't going back, weren't, quote, living up to the bargain they had made when they got the vaccines. This week, the governor seemed to be pretty satisfied that school districts, even if they weren't going to meet that March 1st, quote, deadline specifically, that they were at least making progress to be back in some form in the classroom in early March.
Yeah, it was interesting. He called a kind of last minute, late Friday afternoon press conference to essentially chastise a number of school districts who had gotten the vaccines but weren't planning to meet that March 1 deadline. And it was interesting because, there were really 3 school districts that he was upset about. And I think it frustrated teachers broadly to kind of overgeneralize the problem. But in the days since, he's kind of dialed it back. I mean, it is true these teachers and school districts were able to skip the line ahead of other people who desperately want the vaccine. And so the trade-off per se was to return to classes. And Ohio Department of Education has done some preliminary looks into the effects of COVID-19 on education and have shown that attendance was down and test scores generally were down, and depending on demographics, it was even worse. So I think you're seeing the effects of not being in class and, the trade-offs, whether that is worth it.
Yeah, it's going to be interesting to watch to see how it all turns out. The testing in particular, I mean, Bob Clegg, IMA, public records, everything should be open, but I wonder if when they do the standardized tests, which now looks like they're going to do it, the president wants it, the superintendent of Ohio schools wants them, just basically to see where students are, which kids are behind, where they're behind. But, parents, politicians are going to use those test scores to judge the schools.
That's right.
And
That's right.
is that fair? I mean, I don't want to maybe they should be private. Maybe these test scores should be private. It's like your math test you took on Thursday. That's not open for public records, but I don't know. What do you think, Bob?
Yeah, I thought that these tests were not going to be used for any kind of school evaluations or district evaluations, and I don't think they should be. But as far as transparency on this, yeah, I think it's got to be out there. I think parents need to know how far behind their kids are. This has been a long time. We're at now a year where a lot of kids have not been in school. I think they need to know how far they've fallen behind.
Yeah, Sam, I think the parents should know, obviously, but should everybody know that this class here was really behind when they're just trying to figure out how to help them going forward?
I'm afraid of the politics of that, Mike. I'm afraid how people will use that. And something else, I'm going to push back against Bob. I don't think people really understand the effect of this virus and the long-term effects it can have on you. Not only with your lungs, but your cognitive process, your ability to breathe, your ability to participate in a lot of things. I think the school systems have opened themselves up for litigation. And there will be parents who are gonna litigate when their kids really get sick. And the further out they get, they didn't sign any waivers and you're putting them back in school. I don't think a kid loses that much from 12 months to 18 months of school, long as they are healthy. But I'm going to tell you, if they get sick, the school's going to have to carry the weight of this.
Yeah, I do know that certainly in many districts, Columbus being one, where if parents really feel like they don't want their child to go to school, they can have the option to continue to learn at home. So maybe that will maybe that'll ease some of those concerns for folks who are really concerned about their child getting sick. Anyway, our next topic, as Governor DeWine starts to ease up on the health orders, Republican state lawmakers continue to make it harder for him to impose them, at least long term. The Senate has passed a bill that would limit states of emergency to 90 days. It would allow the legislature to rescind those states of emergency after 30 days, and it would allow lawmakers to rescind health orders after just 11 days. Another bill would cancel any fines businesses received for violating health orders during this COVID-19 pandemic. Its sponsor equates the move to laws that erase criminal records for certain offenders. Jesse Balmer, I don't recall a whole lot of businesses getting fined for violating COVID health orders. The governor always would say, we're trying to, get them to comply. Do we have any idea how many businesses actually got fined?
So I don't have a specific number for you, but I would say the Ohio Liquor Control has been monitoring this, and there's probably about a couple dozen every month or so that come out and have hearings. They're for things like perhaps employees not wearing masks. They're for too many people, just like a large crowded group in a bar. Kind of, it isn't kind of like your minor infractions. It's really when they see larger issues, a very large group of people gathering without any sort of safety precautions. So those are the types of issues that are going before that commission. And then of course the business has an opportunity to explain this situation and potential fines and so forth from there.
Yeah. Getting back to the bill that passed the Senate is now before the House. Apparently the House Speaker supports it. Bob Clegg, is this wise? The 11-day health order limit seems kind of short.
Well, I don't know if it's too short or not, and that's the problem with a lot of this. We don't really know what is the perfect way to do this. I think what members of the Ohio legislature is looking at is it's not so much Governor DeWine, but I think they're concerned about the future. They look at states like Michigan and that governor, Gretchen Whitmer, where she's been so draconian in her shutting down of that state. And I think here in Ohio, the legislators don't want to see that happen in the future. I mean, Mike DeWine's not going to be governor forever. So I think there's a lot of this is planning so that if the day comes that we do have a more Democrat governor who would want to try to do that kind of thing, these laws would prevent them from doing it.
Sam Gresham, we keep hearing calls for Open Up Ohio, and Ohio is fairly open. I mean, there's no big crowds, but the bars are open, the restaurants are open. You can go shopping anywhere as long as you're staying 6 feet apart, things like that. But shouldn't lawmakers have some kind of a check on long-term health orders that go on for, months and months?
No, I disagree. I think it's the period prerogative of the governor and the health department of the state to make that decision, not politicians in the General Assembly. I think this is a pure element of hypocrisy, and particularly directed at the Republican Party. This man's in your party. He's trying to do the best for the community, and your capitalist, greedy tendencies come out, and now you're going to attack him because he is trying to do the best for the community from a health standpoint. When we come back to this period and historians look at it, stupid stuff like this Ohio General Assembly is going to be doing, it's not going to be viewed very well. It's going to be looked stupid. They do all sorts of things. They only let us have one box to drop off our ballots for an election. So they don't want to protect us. They want to let everybody run rampant and do stupid stuff. The government's primary purpose is to protect the community from itself. And sometimes it needs to be protected from itself. Well, now, I told you, I prepare for the worst solution and hope for the best.
Bob,
I don't think this thing is over yet.
Let's let Bob Clegg have a chance to respond to that.
Well, I mean, I think Sam's a little over the edge on this. I mean, come on. We can't have our state shut down. The damage it does to individuals mentally, financially, we have to take those kinds of things into account. You can't just worry about whether they're going to get COVID. You have to worry about whether they're going to be able to make mortgage payments, whether they can keep a business going, whether they can keep paying their workers. I mean, these are issues that have to be dealt with. And you can't just say, well, we got to stay locked down because it's a health crisis. You can't do that and expect people to live.
Well, Jesse Balmer, let me get Jesse Balmer to weigh in on the process. Where does this stand? Is the House going to approve this, and then Governor DeWine has said he'd veto it?
Yeah, I think they're going to approve something. I think DeWine and the House are going to try to work together to get something less, maybe fewer, like more days, maybe less restrictive than what the Senate passed. I think the version that passed the Senate, the governor said he would veto, and he has vetoed other restriction on the Ohio Department of Health's ability to either create health orders or enforce those health orders. So that would be consistent with his past practices. So I think the governor is hoping he can negotiate with the House on this and maybe pass something that everyone can agree with, and we can move on from this issue. But I don't know if that will happen.
Or maybe
may I push back on Mr.
We got to get to off the record there, Sam. Sorry, we're out of time. Let's start with our off the record final parting shots, and Sam, we will start with you.
Well, Mr. Clegg, my response to you is that you don't know about South Korea, North Korea, Italy. All those countries did that, and they're much better off. We need to do that too.
All right. And Bob Clegg, you're next.
Michael Barone, a noted political scientist, did a study of all 435 congressional districts, looked at how they voted in 2012 and how they voted in 2020. The biggest swing to Republicans was in the 6th congressional district here in Ohio, represented by Bill Johnson, which runs from just south of Youngstown all the way down to Portsmouth.
That's Ted Strickland's old district. He was the Democrat
Yes.
down there. Yeah. We'll see how it turns out next year. And Jesse Balmert, our final off-the-record comment from our panel.
My colleague Jackie Borchert pulled all of the license plates, the vanity plates that were rejected by the Ohio Bureau of Motor Vehicles, and many of them had colorful things to say about the novel coronavirus.
Yes, and like the Ohio Division of Motor Vehicles, you can't say them on television or we get fined. Anyway, it has been a long time coming, but Delaware's own and the nation's 19th president has his own bobblehead. The National Bobblehead Hall of Fame this week, or last week, actually unveiled Rutherford B. Hayes bobblehead. But it's not all good news. Hayes is part of the Hall of Fame's Neglected Presidents collection. And it gets worse. Hayes is not alone. 6 of Ohio's 7 presidents are among the neglected presidents. No respect. That's Columbus on the Record for this week. Check us out online. Watch us whenever you want at our website, wosu.org/COTR. For our crew and for our panel, I'm Mike Thompson. Have a good week and stay safe.